Morning Crossfire with me, Kofi Bartels. You have the big names, the most pressing issues, and the sharpest conversations.
He must leave that place of talking into this place of doing.
Nothing that's paying through their nose, and you are telling them after training they can't migrate. I will not be part of those who will give soft landing to these guys who are running the affairs of this country.
People are dying every day. In an hour, people just go in and come out and read out stories to us. Come on, Kofi.
We must step beyond the talk. We have the analysis.
Join us as we dissect the headlines, bring you exclusive interviews, and dive deep into the heart of the matter. The big conversations live here.
Join Kofi Bartels on the Morning Crossfire, weekdays 5 a.m. to 9 a.m. only on 99.3 Nigeria Info.
This is Morning Crossfire on 99.3 Nigeria Info.
Good morning and welcome back. Still the Morning Crossfire right here, 99.3 Nigeria Info. It's raining cats and dogs in my part of Lagos. Of course, we are on Victoria Island, and I don't know what the weather is like where you are, but oh my, I didn't expect the rain to fall. I just remembered that I forgot to take something inside at home, and the rain is pouring out. I don't know about you. Maybe you left your clothes out to dry, you went to work early, and then you saw, oh, it's raining without warning. Some of you may be stuck in the rain as I speak. It's heavy. Is it raining in your part of the city? I'd like to know. But today's Thursday, and we'll keep the show going despite the rains. And so I thought so with you, if you're out there, please stay safe. And if you can shelter in place, please try and do that. It's Thursday, time for Health Thursday. We're talking disability matters right here on the Morning Crossfire Health Thursday, and access to healthcare for persons living with disabilities or physically challenged persons. And of course, this is all to mark the global commemoration, which was some days ago. We'll try and get our guests ready, I guess joining us virtually ready, and then of course we'll put the conversation on the air. Now, if you're a person living with a disability, would like you to call in and just tell us your experience in accessing healthcare. It's very important right here in Lagos State or in any part of the country. So please stay with us. This is a Morning Crossfire and Health Thursday.
It's more than the absence of illness. It's the state of complete physical, mental, and social well-being. But let's delve deeper. Health is the heartbeat of life. It's the rhythm that keeps us moving forward. The pulse that echoes our vitality. It's a symphony of balance and harmony, resonating in every aspect of our existence. Health is a silent conductor, orchestrating the dance between the body and mind. It's the energy that propels us towards our dreams and aspirations. It is the foundation upon which we build our futures. So, what is health to you? Join me, Kofi Bartels, this and every Thursday for Health Thursday, 8 a.m. on the Morning Crossfire as we explore important issues affecting your health. Only on 99.3 Nigeria Info.
This is Morning Crossfire on 99.3 Nigeria Info.
All right, welcome back. To be part of the conversation, please call our numbers we usually advertise 0201 277 0993, 0201 277 0993. Please call that number. You can also call for our female listeners a special line, which is 0201 465 7190. 0201 465 7190. All right, that's strictly for our female listeners. And then, of course, we have a WhatsApp number being 08095 975805. A WhatsApp number being 08095 975805. You cannot call WhatsApp for now or send a voice note, so please just keep it at the level of WhatsApp messages, and we'll like to hear from you. Now, we're streaming live on Facebook. Head to our Facebook page. You can search on Nigeria Space Info Space 99.3 on Facebook. All right, Nigeria Space Info Space 99.3 on Facebook, or in your browser, just type www.facebook.com/Nigeria Info FM. So we're streaming live on Facebook. We're also streaming live on YouTube. And on YouTube, please search for Nigeria Info FM as well. Nigeria Info FM on YouTube, and you can watch the show live from there. Okay, so permit me to introduce our guests, and sorry for the lull. We just took some time to get something sorted out here. I'd like to say good morning to Mrs. Adenike Oyetunde-Lawal, who is General Manager of the Lagos State Office for Disability Affairs. Adenike Oyetunde-Lawal, good morning to you. It's good to have you. It's been quite some time.
Good morning. Thank you so much for having me. Yes, it has been.
All right.
And it's good to have you here. Last time we chatted, you were somewhere else.
Yes, indeed. Yes, indeed. And of course, maybe we'll move it from a radio conversation to one-on-one shy ideas and all that. Adenike, it's good to have you. I was telling her, Adenike, while we were conversing before she came on air, I won't be surprised if, one or two people will call and want to take us away from what she's here to do, which is talk about something very important to we miss you, we love you, when are you coming back and all that. Okay, and she's doing a great job as an official of Lagos State Government, the General Manager of the Lagos State Office for Disability Affairs. Now, we're looking at improving healthcare access for persons living with disabilities. Every now and then you get someone who is, or persons with disabilities, sorry, because Adenike has corrected me. Every now and then we get people who call in, and you never know that they have one disability or the other. Am I allowed to say physical challenge? Is that okay? Is that acceptable?
Okay, so so let me quickly do this. As with almost everything, even disability language is evolving. And a lot of the times you find out that based on climes, different terminologies are adaptable and acceptable. What I have realized in Nigeria is there are two schools of thoughts when you want to use physically challenged. There are some schools of thoughts that say, no, I am not physically challenged because in itself is discriminatory. And there's another school of thought that accepts the term physically challenged. So it's, for me, I always say persons with physical disabilities to be on the most politically correct side and to avoid the dichotomy. So I would often say persons with physical disabilities, persons with hearing disabilities. And when you want to go into in depth into hearing, for instance, you say persons with profound hearing loss, total hearing loss, or low hearing. So yeah.
Okay, all right. Because I mean, as these things evolve, we also have to evolve with them, and also grow along with them. So from time to time, we get someone will say, "Oh, I have this disability or the other," and you'll be like, "Wow!" So this person who's been calling all the time. I never knew he or she was living with such a disability. For instance, when I was on the other station, I could realize a lot of a good amount of my listeners had impaired vision. Yeah, and it excited me, really excited me, and I've been thinking about what to do to highlight the contributions of people who have, who are visually impaired, to society, which is amazing because of the way we situate people who have visual impairment in this country. But Adenike, tell us about the IDD and what exactly it means to those of us in Nigeria and in particular in Lagos State.
Okay. So the International Day for Persons with Disabilities is a day that started as far back as 1994. And it's the third day in December every single year, which was set aside by the United Nations to celebrate, speak on, talk about, advance, highlight, focus on key areas of disabilities and inclusion across the world. And as you might imagine, every year is thematic. And this year's theme the global theme was fostering disability inclusive societies for advancing social progress. However, from experience, you find out that from climb to climb, they have adaptable sub-themes as is. And the focus of this year was basically about highlighting, again, concerns about justice, equity, and sustainable world solutions and participation, like you rightly mentioned, for persons with disabilities across the board. Oftentimes, you come to terms with the fact that persons with disabilities are either not recognized, are not known. Disability conversations are not front burner conversations. And so until a person, for instance, calls you on air to highlight certain challenges, quite often a lot of your listeners do not pay attention to it. In my own case, for instance, I'm a person with acquired disabilities. And I acquired my physical disability almost 20 years ago when I lost my right leg above knee to bone cancer. And prior to that, I had never paid attention to disability of any sort. Yes, had I seen people with maybe wheelchair or crutches? Absolutely. But I hadn't paid attention. I didn't pay attention to even the simplistic examples, like you rightly mentioned, vision loss, complete or low vision. And because of that, you see that conversations of this nature are actually highlighted and spoken of and discussed every 3rd of December. In Lagos State, we did do that last week, and we spoke thematically across some key areas, health, transportation, education. We also touched on technology, assistive devices or assistive technologies, which is one of the tools that makes living more easier for persons with disability. And of course, it varies from type of disabilities that individuals live with and the nature of how the extent of the disability, because we have people that are mildly disabled, we have people that are moderately disabled, and we have people that are profoundly or severely disabled. Oftentimes, people that are profoundly, disabled, a lot of the times are the ones that often have to live with one form of assistive device or the other. One person that comes to mind as I speak is the late Stephen Hawking. People know him as a scientist and blah, blah, blah. He developed ALS very early on in his life. And you will see that through his life and technology exposure, some form of technology was made where it was his thoughts. He couldn't articulate. He was not verbalizing his thoughts. But there was there was a device he had that you would hear what Stephen Hawking was saying. And in spite of that, see the tremendous impact that he made in the entire course of our human existence, and the things that he did in the sciences. So it's why conversations of this nature absolutely necessary in Nigeria, because for far too long we have continued to not pay adequate attention to these categories of individuals and their input first to themselves, and then to the society, and then the country at large as is. So basically, IDD this year was talking about fostering disability inclusive societies for advancing social progress. And for us to talk about social progress, without a doubt, we must have conversations of this nature, which is one key factor why I'm here, because of the role that the media plays in fine-tuning, in shaping and correcting myths and facts and beliefs as the case is. Yeah.
Very, very interesting. And these are the conversations we need to have, in the midst of talking about insecurity, in the midst of talking about inflation and Arsenal and Chelsea. These things slip under the radar and very important. I'm happy you said that the day was celebrated and observed in Lagos State. And you talked about, of course, you've told us about the theme, fostering disability inclusive societies for advancing social progress. So looking at inclusivity from the angle of healthcare, you mentioned healthcare as one of the areas or thematic areas in the discussions and activities here in Lagos State that was discussed. Tell us about what Lagos State has done to make it easier for persons with one disability or the other to access healthcare.
So it's very necessary for us to start by saying, to go in depth, we must understand what inclusion means, what disability means, or what disabilities we're talking about, and what provisions we expect. For when you discuss inclusivity and you talk about health, it's just simply saying and stating that every single person, regardless of their disabilities, has, in the most simplistic terms, equal and accessible opportunities to participate in health activities. And this vary, and it's not limited, from prevention or preventive measures to treatments, as well as ensuring that barriers are removed. And the barriers often would start from clearly the buildings, communication barriers, the barriers of stigma, barriers of adaptable and adapted services, just to ensure that the quality of life of persons with disabilities improves. In Lagos State, the persons with disabilities, for administrative and ease purposes, have been able to put themselves into what we call clusters. And there are about 10 of those clusters. I'll mention just about 5 or 6 of those. They are blind cluster, the deaf cluster, the deaf-blind cluster, persons with albinism, spinal cord injured persons, neurological and intellectual disabilities, persons with dwarfism, persons who have lived and have survived leprosy of sorts, and persons with a category that we call invisible disabilities. And some of the examples are lupus, as well as the sickle cell disease. Now, each of these categories require different types of adaptability to access healthcare. In Lagos State, there are well over 300 primary healthcare centers. And unfortunately for us, quite a number of these do not have accessible buildings, sadly. And the other part that we've come to terms with the fact is that a lot of these persons with disabilities that live in these inter-rural areas have specialized needs that are not provided for at these primary healthcare centers. So oftentimes you have to see them commute to the nearest general hospitals or specialized hospitals. I'll give you a typical example. For people with dermatological needs, for instance, and let me pick persons with albinism. You see that the biggest place that that we have in Lagos State that does an excellent work is LASUS. And that's because the dermatology unit there is specifically prepared for them, as well as other cases that they handle, as well as the doctors in charge there are doctors who have particular interest in the whole cause for albinism. And so if you present as a person with albinism, maybe somewhere in Ibejuleki or Epe, for instance, and there's a case that is not easily understandable. What the drive that we're pushing for now is for them to ensure that you are referred. Yes, is commuting a huge challenge? Absolutely. But it's best that you go where they have the skills. And I'll give you a very typical example. Someone presented in one of those areas that I mentioned, unfortunately, as a person with albinism, and it was a skin lesion. And for those who know, persons with albinism do not have melanin, so they're easily susceptible to skin cancer. Unfortunately, clearly, and for whatever it was, the persons that they had met primarily didn't know what it was and continued to do something else. Thankfully, eventually got wind of it, and the person was referred to LASO when it was still manageable.
Okay.
And clearly, we had seen that it was an early onset of skin cancer.
Okay.
An early onset.
Yeah. Adenike, please hold the thought. We want to go for a commercial break. It's easy for me to tell you because you know the importance of that better than other guests that we have. So we'll be right back. Please stay with us.
More talk, news, and sports after this.
Neighbor, I beg you get change. I won't give customer.
I don't get to. Get First Money Merchant POS. Let customers pay with cards and never miss a sale. Don't let no change cost you sales. With First Money Merchant POS, enjoy fast payments, instant settlement, and secure transactions. Visit any First Bank branch or sign up on www.firstbanknigeria.com/get your POS to get yours today. First Bank, you first.
Africa is all connected. With Turkish Airlines FlyFest, fly to Europe, to America, and to Istanbul at special prices. Book your ticket until December 15th for flights between September 15th and December 15th. For details, please visit turkishairlines.com. Turkish Airlines.
I'm in love. Sonia tomato mix, stand up. Is it to open? Is it to squeeze? Is it to scoop? And is it to stir?
Sonia tomato mix in a new stand-up pouch.
No matter where you are, city or out of town, you deserve a great reliable connection. The Airtel 5G Smart Connect not only delivers that, but also gives you unlimited data to stream, download, and browse in your home or office. It also comes with wider coverage and super fast speed, all for just 25,000 Naira. Visit the nearest Airtel shop to start enjoying unlimited data now. Airtel.
This one where you dey share Coke and Fanta today. What's it happen? My guy, you never hear them say 35cl plastic bottle don't drop to 300 Naira. 300 Naira. No be 350 we dey buy am before. Yes, so the price don't change. Now 300 Naira now. Meaning say you dey save 50 Naira for every bottle. This one, now real small price, big refreshment. Oh yeah, my guy, you said take one bottle.
No lose guard, grab your favorite 35cl plastic bottle for Coke, Fanta or Sprite for just 300 Naira for any store for your side. Promo go end when our will finish. Coca-Cola, real wonder.
Mommy, what is 3 + 1 + 1?
5.
So what's 4 + 1?
That's 5 school days of nourishing Ovaltine multi-chocolate goodness.
Yummy!
Buy the special Ovaltine pack with 4 sachets and 1 free for every school day. That's not all. Ovaltine is enriched with calcium, vitamin B12, and malt to support learning and playtime. Ovaltine, smart choice for smart kids.
You don't just vibe to anything, and that's okay. Do you like it hot?
Hit me.
Then go for Mini Noodles Ninja Pepper flavored, the spicy rebel. Do you like it fresh?
Smooth.
Then get your Mini Noodles chicken and veggies flavor, the fresh gang. Maybe you like to party.
Gigi.
Then you need to have a taste of Mini Noodles Party Jollof flavor. Party starter. Or you could be a foodie.
That's it.
Then you'll love Mini Noodles sloppy chicken flavor, the foodie vibes. Whatever you like, Mini-Me's got a flavor for you, so pick your vibe. Mini-Me Noodles. Slop life.
I am the chef of life with Mr. Chef. Niger vibe, Mr. Chef, 2 finger crush. I am the chef of life with Mr. Chef. I am the chef of
Mr. Chef, taste home, taste culture.
Chef of life.
The biggest food festival on the African continent is back. It's the GTCO Food and Drink Festival, wait for it, Holiday Edition. That's right, on Saturday 20th and Sunday 21st December 2025 at the GT Center, Plot 1 Water Corporation Drive, Oniru, Victoria Island, Lagos, the GTCO Food and Drink Festival returns for a special holiday edition. Think mouth-watering street food, retail stores, exclusive chef demonstrations and master classes. And for the kids, a magical holiday wonderland. The GTCO Food and Drink Festival is for everyone. Your holiday experience starts here and attendance is free. After all, what's a holiday without good food? Don't miss the holiday edition of the GTCO Food and Drink Festival on Saturday 20th and Sunday 21st December at Plot 1 Water Corporation Drive, Oniru, Victoria Island, Lagos. The GTCO Food and Drink Festival, supporting small businesses and promoting enterprise.
Whether you're chilling with your friends, in town with your clique, watching a movie with your bestie, turning up at parties for the jollof, or just chilling at home by yourself, reach for a refreshing bottle of Razzle. Razzle your world and express yourself with the new and exciting flavors of Razzle: cola, orange, and lemon. Razzle your world.
Africa is all connected. With Turkish Airlines FlyFest, fly to Europe, to America, and to Istanbul at special prices. Book your ticket until December 15th for flights between September 15th and December 15th. For details, please visit turkishairlines.com. Turkish Airlines.
Start your day and have a good time. Kivo Krima. Where you need to have the break time. Kivo Krima. If not tea, Papa Garita. Kivo Krima. Kivo Krima.
Every meal I cook must taste just right. Rich, delicious, full of love.
We hear you. Your Maggie Star in double cubes. Double the flavor, double the convenience. The same trusted taste you love. Maggie Star double cubes. Made from fermented soya and other selected ingredients for that deep flavor and quality that only Maggie brings to your dishes.
Absolutely delicious.
Get Maggie double cubes today. Me and Maggie, so good together.
No matter where you are, city or out of town, you deserve a great, reliable connection. The Airtel 5G Smart Connect not only delivers that, but also gives you unlimited data to stream, download, and browse in your home or office. It also comes with wider coverage and super fast speed, all for just 25,000 Naira. Visit the nearest Airtel shop to start enjoying unlimited data now. Airtel.
The biggest food festival on the African continent is back. It's the GTCO Food and Drink Festival, wait for it, Holiday Edition. That's right, on Saturday 20th and Sunday 21st December 2025 at the GT Center, Plot 1 Water Corporation Drive, Oniru, Victoria Island, Lagos, the GTCO Food and Drink Festival returns for a special holiday edition. Think mouth-watering street food, retail stores, exclusive chef demonstrations and master classes. And for the kids, a magical holiday wonderland. The GTCO Food and Drink Festival is for everyone. Your holiday experience starts here and attendance is free. After all, what's a holiday without good food? Don't miss the holiday edition of the GTCO Food and Drink Festival on Saturday 20th and Sunday 21st December at Plot 1 Water Corporation Drive, Oniru, Victoria Island, Lagos. The GTCO Food and Drink Festival, supporting small businesses and promoting enterprise.
Mom, let's celebrate Christmas at its peak. I want Christmas lights so bright they could see it in space. Wow! I want a Christmas tree so tall players would have to watch out.
Think bigger!
Like what?
Pancakes stacked to the ceiling, delicious eggs, and a peak milk smoothie.
Just for me. Now that's Christmas at its peak.
Because truly, a peak Christmas is Christmas with Peak. Peak. Reach for your peak.
Over on its 12th day of Christmas, my Maggie gave to me 12 slices suya, 11 orishi, 10 wraps of moi moi, 9 efodiro, 8 plates of nkwabi, 7 pepper soup, 6 season snails, 5 fried fish, 4 cocoa bangles, 3 patty jollof, 2 geese dodo, and fufu with egusi, Have a delicious holiday season with Maggie. Me and Maggie, so good together. Me and Maggie, so good together.
This is Morning Crossfire on 99.3 Nigeria Info.
All right, welcome back. We still have with us Mrs. Adenike Oyetunde-Lawal, General Manager of the Lagos State Office for Disability Affairs. And of course, this is in commemoration of a day that was marked on the 3rd of December, the International Day of Persons with Disabilities. And it's commemorated every single year. The theme for 2025, the 2025 observance, as our guest has informed us, is fostering disability inclusive societies for advancing social progress. Now we're looking at this in the Nigerian context and in the context of Lagos State. Do persons with disabilities have access to healthcare? And if they do, what is the level? How can we improve it? Please call the numbers really advertised and have your say. If you're someone living with a person living with disability, we'll like to hear from you. If you live with a disability or the other, or even if you don't, but you care for someone who does, what is your experience in accessing healthcare in Lagos been? What changes do you like to see, or what do you want to see in hospitals and clinics to make them more accessible? Have you ever faced any fiscal, financial, or maybe even communication barriers while trying to get healthcare? And what is the one thing? You think that the Lagos State health system should fix immediately to support persons with disabilities better? If you work in healthcare, what support or training do you believe you should be given to help staff, including yourself, better serve persons with disabilities? Because most times we don't even look at those who work in healthcare to also say what can they do, do better. Now, Nigeria, it's estimated, has 25 million persons with disabilities. So that's a significant constituency. Because disability is extremely diverse, like our guest has told us, we have several types, and Lagos State government has divided it into clusters, grouped them in clusters. She told us about that. There's some health conditions associated with this, which result in poor health. Extensive healthcare needs in many cases are required for such persons. Only a few disabilities do not require such. Generally, all people with disabilities have healthcare needs as everyone else, as you do, as I do. They therefore need access to mainstream healthcare services, and that's why we have our guests here today. Article 25 of the UN Convention on Rights of Persons with Disabilities, reinforces the right of persons with disability to attain the highest standard of health without any discrimination. Well, what is the reality? Well, the reality, according to the World Health Organization, is a few countries provide adequate quality services for people with disability. Before we went to the break, our guest was telling us what Lagos State has been doing to ensure improved access to healthcare for persons with disability. Adenike, please go on. You were making a very important point before I cut you off, and you gave us example of a Lagosian who is living with albinism and didn't even know they had skin cancer and was referred to a tertiary. So please tell us some more about that and all this.
So the point I was trying to make it was that at LASUS now, dermatology unit is very thorough for persons with albinism, and that is one of the efforts that the state government has continued to put. Secondly, the sickle cell center has also been a sort of partnership with the Lagos state government, and our hope is that persons with sickle cell disease, whether out of pocket or through government intervention, subsidizing it, can get the care. There's a video that is currently going viral about solutions to sickle cell disease. That is also one of the efforts that government is doing. When it also comes to the care for the condition called lupus as well, from LASUS to, even though Luth is not a Lagos state owner run hospital, but a lot of the efforts there are often in partnership. That also helps. In LASUS, for instance, the state government has also done this physical and occupational therapy efforts. Now, one of the key factors that must be spoken of this morning is for the care of those with neurological and intellectual disabilities. Simply put, those with cerebral palsy, a lot of the times Down syndrome, autism, because a lot of it affects the intellect. And we see that quite a number of these categories are themselves profoundly disabled. And oftentimes they need from occupational therapy to speech therapy to physical therapies. As is across Nigeria, the whole JAPA syndrome, many of these specialists are leaving. However, Mr. Governor had committed that at the Masses Specialist Children's Hospital, currently ongoing construction, there will be an early interventions department, and conversations and work has started in earnest to seeing that. And the purpose is to ensure that there is a multi-sectoral, multidisciplinary, one-stop solution. Psychotherapy, psychologists, all the forms of therapies that are needed, the neuro care that is also needed as well in ensuring that persons with these specific needs. At the moment, they're scattered. So we're hopeful that we can put them all under one roof for ease as is. And hopefully that also becomes replicated in most likely maybe across the 5 senatorial districts in Lagos. The healthcare scheme from Lagos State is currently undergoing a lot of revamping, and I'll explain to you why. Because of the specific needs of persons with disability, where most of them would have to take advantage of the offerings of insurance in the full gamut. Many of the insurance organizations or companies are reluctant in carrying us on board. It is what it is. Conversations have started, and we're really hoping that away from the government's funding, that we would be able to get private partnerships in terms of that sort of funding as well. When we come to accessibility, like I was saying earlier, there are over 300 primary healthcare centers. There's quite a number of these healthcare centers have been upgraded to hospitals for ease, especially to persons with disabilities as well, so they can get the first primary care that they need. But away from that, the communication gap is also a big issue. So the inclusive unit at the Ministry of Health and the agency has just recently started conversations to see how we can bridge that gap, because oftentimes it's one thing to go to the hospital, it's one thing to be able to communicate. Sadly, lives have been lost because of that gap, unfortunately, either for signers or sign language interpreters. And that's why sign language interpreting, personally, as to me, my hope is that just like South Africa is going to make it a national language very soon, it also becomes something that we can inculcate into our curriculum, so that children, adults can know the basics of good morning, good afternoon, how to administer care. What else is the Lagos state government doing? We're also ensuring that away from all of this, we're able to provide certain forms of assistive devices. Now, with the tax regime soon to start in January, it's important to state that the federal government, with the National Commission for Persons with Disability, has worked on ensuring that medical appliances get a certain extent of rebate. But our own ask has gone further in ensuring that away from this, that we are able to explicitly mention assistive devices. So for people who bring them into the country, or people who are hopeful to locally manufacture assistive devices, that there's a semblance of rebate, because across the world, unfortunately, assistive devices, the cost of assistive devices still remains a huge challenge. And that has posed a major issue for us, even at the agency in Lagos State, because again, assistive devices, sadly for permanent disabilities, are not one buy off. You have to change them periodically. And the nature of usage will determine how often somebody needs to change them as is. So I believe that I've just run through some of the things that we have currently, offerings that we have, as well as adding the ones that we're hopeful to bringing on board in the nearest future.
Well, Adenike, I'd like to say you're doing a good job, good work, and I can't think of a better ambassador for Lagos State government when it comes to ensuring that there is a connection, with the community of persons with disability in Lagos State, because Lagos State is there was a survey that was carried out some time ago. This is the Center for Citizens with Disabilities. It ranked Lagos State top in the implementation of accessibility to infrastructure and other services for the benefit of persons with disabilities in accordance with the National Disabilities Act. This is the Center for Citizens with Disabilities. They conducted this study in January 2024. It was a survey supported by the MacArthur Foundation. It was conducted from October to November 2023 to assess the level of implementation of National Disability Act and UNIDIS criteria. So that was published in January 2024, but done in October to November 2023. So I think it's a kudos to you, and of course to the governor of Lagos State and the government of Lagos State. If Lagos is at least on paper and in broad infrastructure and policy inclusion, better positioned than many other states to support persons with PWDs. But doing better than others is not the same as being fully inclusive. I'm sure you agree. There's a lot of room for improvement.
I wish you were looking at me, because I'm like, okay, not bad, but there's a lot of work to be done. Let's be, quite honest with ourselves. And unfortunately for us, even though Lagos started the whole conversation, from the law to the agency, in Nigeria, at the moment, there are about 15 or 16 other states that have not only domesticated, but now have agencies that oversee matters that concern persons with disabilities. You will see that when you go to these places, yes, Lagos tops, realistically, but when you live in Lagos, you know that for the level that we're going to, we have a lot of work to be done. And I believe that one of my biggest interests is to, you mentioned something earlier about how your listeners who can do stuff, in their own space, employers, business owners. It's not just the government's responsibility, unfortunately. There are people who have had drivers who have driven them and suddenly lost their sight. What do you do to ensure the adaptability of that particular person when they stop to drive you? There are schools in Lagos, government-owned, private-owned and run, that teach people adaptability into the world of blindness, even as adults, teaching them how to learn Braille and all of it. Inclusive education has a very long way to go, even though we currently have about 50 of those across the state. We're optimistic that in the next year and a half, there will be more inclusive units across the 5 senatorial districts. Right. And we have started working earnest on that as well, just so that the public education for inclusive education doesn't dwindle, as well as the quality of the teachers in these schools. We also, and that's to target the out-of-school children with disabilities, because it continues to rise. And that's one of the biggest things that we have noticed that will drop that number, ensuring that we increase the number of inclusive schools across Lagos State, as well as the quality of the teachers in these schools, so they can move from primary to secondary. In Lagos State, there are 10 Lagos State owned and run tertiary institutions, and all 10 of them are mandated to ensure that first you get admission. That's it. If people come to the agency and say, "Oh, this," and you get admission. It's really what it is. And then also encourage them by giving them a scholarship for as long as in school all through. So just to encourage them to go to tertiary education as well.
That is huge. That is huge. Okay, I'll come back to that. Let us pick our calls now. 99.3, good morning.
Yeah, good morning, Kofi.
All right, welcome.
Rotimi from Ikoyi.
Okay, Rotimi, please.
I just want to ask your guest, is there any law protecting these people living with disability, that is physically, who are abused physically or who are taken advantage of physically? Because there was a day when a conductor who was a disabled person, the two legs are not good, and they're having a problem with a passenger. This passenger was beating him. I was forced to go and meet the passenger. Look, whatever this conductor might have done to you, look at his condition. Why are you beating him this way? Molesting this guy? I was crazy. Is there any law protecting them being abused physically?
All right, thank you.
That is my question.
Thank you. We'll take a few more calls and then allow our guest respond to them wholesale. 020127709993. Hello. Your name,
Good morning. Good morning. Okay, my question, this is Joyce. My question is for the blind that came out to protest some time ago, saying that their schools were shut down. I want to know, has those schools been reopened? Because they came out to protest at the airport.
Okay.
And again, I want to emphasize what you said about South Africa, making sign language second language to be taught. Else, everybody's supposed to know sign language. So I want to emphasize that should be looked into. It's very important.
All right,
even if you don't have children that use sign language, if you walk around and somebody with sign language and can use that on them, those two things are very important.
Joyce, thank you so much. 99.3, your name, location?
Good morning, Mr. Kofi. Good morning to your guest, Mrs. Obole. Madam Adenike, I want to say thank you for what you've said this morning. But because I work with a community that have persons with disability, I just want to bring a couple of things to your
Mrs. Obole.
knowledge. I won't waste time, Mr. Kofi.
Yes.
Now, where the disability community is concerned, some of them, I think because of data collation, which should be quite transparent, because it helps in the process of assessing healthcare in a hospital facility, and it makes it less cumbersome. And so most times the data is lost, and when they come, they're just moving left and right. It's quite cumbersome for them.
Are you saying data?
Can you hear me,
are you
sir?
saying data collation?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
There's not enough data in which aspect? Which of?
Okay, good question. What I'm trying to say is, when they come for their first visit, when they come again, some of them complain that they will tell them to re-register, that when they came before, it was not properly booked. And so it makes it a bit cumbersome for them. Another concern I want to raise is the distance between here and there for persons with disability. From where they are being booked to take their vitals when they come in first, to where they are eventually attended to, the distance is a big issue. And the third thing I want to raise is cost, finally.
Cost.
I used to think that cost now.
Mm-hmm.
I used to think that those with eye issues, when they come, the money they pay is not much. But rubbing minds with a couple of them, they say they still pay heavily for medication. I want her to say if it is true or false. Okay. Those with glaucoma and a couple of eye issues,
right.
When they come, they say they don't even have.
Oh, we lost the call. I don't know if it's network. So she's talking about data. That each time they get to the health centers or the hospitals, they have to re-register or re-enter their data. And then she's also talking about the distance between here and there. When they go for their checkups, in the hospital, they have to be sent from place to place, even though they are persons with disabilities. They have to do the running around themselves. Then thirdly, she's talking about cost. That she's spoken to some persons with visual impairments and visual ailments, and that they're still paying very high for treatment in government health facilities. And those are the three. I think we have only 2 minutes. I don't know how you're going to squeeze all your answers into one, into this time.
Run through Mr. Rotimi. Mr. Rotimi, of course there is a law. Every single person knows that there are laws. Ignorance of the law is not an excuse. So what is the purport and the work of the Domestic and Sexual Violence Agency if it's not to protect persons with disabilities? I often don't like sensationalized storytelling. You saw it. Did you record it? The best you could have done for that PWD, away from saving, was to get a picture, record it, work with NURTW. We work with BRT. BRT has a structure. Any person who is abused on any of the BRT buses, the only thing we tell them is get us the number of the bus. It's always at the back. Once you get the number, get the time, we always get to the persons who perpetrate it. It is continuous and continued education, unfortunately, because when you train this group of people today, in another 3, 4, 5 months, they leave the job. We have to keep training and retraining and continue to train. So I'm here today because every single person who's listening, whether a person with disability or not, is the number one advocate for inclusion and disability. The person that talked about the federal school, I'm glad you mentioned federal. Federal is out of my purview. It is exclusively a federal government concern, even though FAAN MD, myself, and the entire team were on the phone to discuss that. So I do not know if the school has been opened yet, but I know that the Minister for State for Aviation had gotten the team into a room to have the conversation. And I believe that there were some promises made gearing to 2026, but as we speak, I do not know if the school is open. And finally, Mrs. Obodu, unfortunately, the cost of healthcare across the globe is high, whether you're a person with disability or not. And sadly, until there's a subsidy of sorts or there's an intervention, a PPP of sorts, it is just what it is. For eye, for hair, even prosthetic assistive devices, like I mentioned.
Oh my word.
What is 3 + 1 + 1?
5.
So what's 4 + 1?
That's 5 school days of nourishing Ovaltine multi chocolate goodness.
Yummy!
Buy the special Ovaltine pack with 4 sachets and 1 free for every school day. That's not all. Ovaltine is enriched with calcium, vitamin B12, and malt to support learning and playtime. Ovaltine, smart choice for smart kids.
Africa is all connected. With Turkish Airlines FlyFest, fly to Europe, to America, and to Istanbul at special prices. Book your ticket until December 15th for flights between September 15th and December 15th. For details, please visit turkishairlines.com. Turkish Airlines.
There is December, and then there's MTN Yellow Tide December. From Street
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.